Greetings! Welcome to another episode of Caring for You with me, Dr. Terrence. Today, we are going to speak about an ailment that affects mainly women. That is migraine, or migraine headache, or headache. Migraine headache is really caused by blood vessel issues in the brain. It is what you call a blood vessel issue or vascular issue, and it affects mainly women. How does migraine present itself? It has a number of characteristics which we will discuss now. One, it is pulsatile, which means it goes boom, boom, boom. It is normally unilateral, which means just one side of the head. Secondly, it is very intense. It can go up to a 10 out of 10 in intensity. It can be associated with nausea or vomiting, and most time people don't want to hear noise during a migraine, and light bothers them. And so these are the main characteristics to determine whether one is suffering from migraine headache or some other type of headache. So what predisposes someone to migraine? In the first place, the type of diet you might have. For example, those who eat lots of cheese to dairy products, chocolate, for example, are the common ones. Lots of alcohol, and some people have it during their menstrual period or coming on to their menstrual period. And so when people have migraine, we encourage them, of course, to adopt an appropriate diet which will help to deal with the issue of their migraine. So how is it diagnosed? Exactly as I said, it is a clinical diagnosis. There's no special test really to determine if you have migraine. The doctor would ask you these specific questions and determine if you meet the criteria to diagnose you with migraine. And so once you have migraine, what do we do? Not everybody needs a scan. Most people ask for a scan once they have headaches. But we look at particular characteristics and circumstances under which to determine if you need a scan or not. So not everybody needs a scan. And so the next step is to start your treatment. And so we use different types of medications. We can use tablets, we can use injectables, or we can use inhalatory medication. And therefore, the doctor has these options at his disposal to deal with your migraine. But most commonly, we give maybe paracetamol, ibuprofen, Advil, naproxen, or what we call the NSAIDs. In the US, we say Tylenol, paracetamol, and most people can benefit from these medications. But when these don't work, then we have to go to what we call the real heavy hitters to treat migraine, such as the ergotamines. Here we have Capegot, the triptans such as sumatriptan, whether they're injectable or inhalatory, and then you can inject different types of pain medication, such as ketorolac, diclofenac, metoclopramide, which is also used for vomiting and so forth, can also help. And the last and least might be opioid-based, which we try to avoid as much as possible. And so you can have even medication to deal with your migraine on a daily basis. I use, for example, amitriptyline or propranolol. These are medications you can take on a daily basis to ensure that you don't get your migraine headaches. But what is important is that you follow your doctor's orders and you watch your diet in terms of dairy products and alcohol and chocolate, as I mentioned before. And there's a vitamin that has been shown to help people with migraine, and that is vitamin B2. I want to say B2 and not B12, because on some occasions when I indicate B2, patients return with vitamin B12. So vitamin B2 can definitely help in that case. And so for your migraine, you can get it under control. Make sure you see your doctor, follow your doctor's orders, and follow an appropriate diet and lifestyle that helps you to have a healthy life while dealing with your migraine. Thank you very much. And this was another episode of Caring for You Dr. Terrence.